Auntie Nancy, Chairman, members of the board, my executive colleagues, the staff who are with us today, and the community, and I thank you all for coming. About this time a year ago, I got a call from the Department of Health following, the recruitment process, to tell me that I was being offered the position as the Chief Executive of Southwestern. For those who know me well, I've worked out here for quite a long while. I went down to Bowral in the early 80s and was involved in community health before I went across to the acute care service. So I've worked out here in Southwestern. It's a bit of a worry when you think about it, for over 20 years. And in fact, one of the first positions that I actually took when I left uni was actually here at Liverpool. So it was a bit like kind of coming back. But when I received that call, I really I really felt very privileged. And I felt very privileged for a number of reasons. The Southwest community is a really vibrant community. They are very committed to and involved with their hospitals, and not only that, obviously the health service broadly, and that's reflected of the robust and strong community participation framework that runs across Southwestern. But also because I had worked over the years with an amazingly committed group of people who came out to the West to provide a whole range of services to a community with a high burden of health disease. And for me, that was really a great reason to want to come and work here, but also over the years to stay and work here. So to have been offered the position in the new local health district really has been a privilege in the last year. I can't say it's been easy though, but it really has been a privilege, and I think the enthusiasm I had then is probably a spark on what I still have now. I want to talk briefly about some of the challenges that have occurred over the year and the things that we've done as an executive, because it has been a bit of a new experience for senior people who work in health. And for those of you who I've spoken to recently, you'll hear me use the word about de-aggregation. We're very good at amalgamating services in health and creating efficiencies and doing that kind of thing, but it's been a bit of a different experience to de-aggregate a service. So I just wanted to share with you a little bit about what was involved, what's been involved with that, and then refer to the achievements. And as the chairman reflected a little bit about the capital works that's occurred, and then just talk then briefly about next year and the things that are a priority for us. As I said to you, de-aggregation is not something that we're used to. The combined area health services were created about 6 years ago, and they brought together large, complex health services. And so over what was then Sydney Southwest, you had over a $2 billion budget, and you had services running from Balmain, as you know, down to Bowral. So to pull these amalgamated services apart has been a difficult and an arduous process, but it's been done in good spirit and with a lot of commitment from people who have worked with the services for a long period of time. But as much as we've been needing to pull those services apart, and when I say that, we've been needing to identify resources and not only money but staffing and where staffing has been located. And when I look around the room and some of the community health people that I can see in the room have had to work out now what part of that position lives here and what part of that position lives here, and can we continue to provide services. It really has been difficult, but people have gone in with really open hearts to try and sort this process out. But the one principle that we said that we really wanted to focus on was that we didn't want to go backwards. So there has been a lot of effort to develop services over the last 5 to 6 years. We wanted to maintain services. So in the restructure that you see that's been created, there is a split of services, but there are also a number of services that will be hosted across the combined LHDs for a period of time until those services are strong and robust enough to stand alone. And a couple of examples of those are mental health, drug health and dental health services, and some aspects of community health where we felt that in terms of pulling them apart, there would be a step backwards. So wherever possible, we've tried to either maintain them or maintain a service relationship. So that work has continued, and remember, in the middle of it though, we had a new government came in who, with a very, very clear and very definitive agenda, a minister who had been in opposition, I think she said to us the other day, 5,000 days that she'd been in opposition, has been very enthusiastic, had very clear ideas about what she wanted to bring in to the ministry. And so with that, we've also had to work through that process. But progressively we're there. We're probably, can I say to you, at the pointy end now of the last bits of services that need to be resolved. And so that process will come to, I hope, a conclusion at Christmas. Everyone probably rolls their eyes a little bit and thinks, will we make it? And I think we will make it by that time. Concurrently though, while we needed to work through with everyone to do that, we've also had to build this LHD. And there were a number of structures and processes in place, but we also needed to rebuild those. So we needed to understand about working with a board and what the board required, and working with subcommittees of that board, and those subcommittees and the governance structures for the board now have been established. And concurrently also needed to set up the operational and executive structures for the local health district, and that included things like the clinical council, our clinical stream structures, and our committees to service the operational roles that the LHD needs to fulfil. So we're fairly much along the line in that regard. It's been, as I said, arduous for some of the processes in terms of setting those things up quickly. They've taken a little bit longer than what I'd think, and the bureaucracy of recruitment and decision making always comes into that, and people will know that well. But again, we're fairly much established now. What we need to be able to do next year is to actually start to build on those relationships and those processes that we've now set up. So it hasn't been an easy process. People have been amazingly supportive, I think, across the LHD and patient around that. And remember, while we've had to do that, the services on a day-to-day basis have continued, and the staff at the facilities have been fantastic in terms of maintaining those services. And yes, we've been through winter and all the things that winter put to us, but again, services have been maintained and progressed and developed over that period of time, which really has been tremendous. What I'd just like to talk about now is a few of the achievements, and as I've alluded to in the course of the year with all this other work that's been going on, there have been some significant achievements that this LHD can be very proud of, and that will see our services well set up for the future. And Capital Works, as the chairman agreed, is one of those ones. There was the Liverpool project was about a $390 million project, and we saw this year the opening of the new part, and I think you would agree with me that it is a most beautiful building, and one that we can be proud of. I was walking up the what I call the boardwalk the other day, well, a couple of months ago I should say, and I met one of our really committed volunteers who was directing people probably, a new direction to take to get to the front of the hospital, and they have been so wonderful in terms of their support for Liverpool over the redevelopment phase. And I said to her, how do you feel about the hospital? Do you think it's lovely? She said, I think it's fantastic. And she said, and we deserve it. And I thought, what a beautiful way to say it, that the people of South West need this, this beautiful facility, but obviously with the facility is the level of services that we can provide. So where we are now, though, is at the redevelopment part of the older part of the hospital, and slowly and progressively those parts of the hospital will open, and we will see it concluded at the beginning of next year. Concurrently also, though, the work, as you can see, and if you live on the other side of the railway line and have to get over here, it's a bit of a trek, is the car park is commenced, and that work will be finished in about April. But again, another significant development for both Liverpool and the LHD. The other important one that was announced this year in the budget by the new government was the expansion of Campbelltown Hospital. The total cost for that project that was put to the government was about 190 million. What's been announced at this stage is the redevelopment of the general part of the hospital. The part that hasn't been resolved yet, I believe, is the mental health side of it. It's worth about 60 million. But the 139 is a fantastic commitment, again, for Southwestern. Over the winter period, Campbelltown saw about a 9% increase in its emergency presentations. So it's significantly seeing an increase in workload. And remember, that's not only fed by population increases, but also by the development of the Southwest Corridor. And if you go out there, for anyone who needs to take a bit of a trip, I went out the other day for the cancer annual general meeting, and the sheer level of development that's occurring on a week-to-week, month-to-month basis, and the number of houses that are growing there is a bit mind-boggling. It's phenomenal, the growth. So that redevelopment will see 90 new beds for Campbelltown. The preparatory work is being done up in this financial year, and the actual construction and work, we trust, will start to happen the year after. So that has been two really important achievements for this LHD in terms of managing an increasing demand and also the workload. I think you would know that the population out here at the moment is about 850,000, significantly more than the population of Tasmania, and just slightly less, I think, than Western Australia. In the next 5 to 10 years, you'll see that grow to 1 million people. So these are big communities, large populations that we need to service, and the contributions that have been made over the last couple of years will put us in very good stead in terms of service development. Some of the other things that we can be proud of over the last year in terms of achievement is Karitani, and the Chief Executive of Karitani is with us today, which is fantastic. Moved into Camden Hospital. In terms of the development of that service for the Macarthur community, it had been talked about for quite a long period of time, and it was a great achievement to see that service be established at Camden to service this area. So that's just fantastic. Campbelltown Hospital received about $1 million to pilot an urgent care centre, a way to improve the management of the high number of level of presentations to the emergency department. That centre opened and has been in operation for now probably about a year, and has been providing an excellent service to the community. $80,000 was received by Fairfield Hospital for the purchase of a new bone density machine, and that's been a significant advantage in terms of expanding services at Fairfield. And Bankstown Lidcombe renal dialysis unit was also expanded, and also under COAG funding we received a trench of money for Bowral Hospital, which saw some changes to the emergency department and to the operating theatres. And the work that was done on the operating theatres had again been talked about for quite a few years. So receiving that money and getting that development for Bowral, I think, has been really important. The other one that commenced this year, which is very important, and the chairman alluded to, or rather talked to it in his speech, is about the Inghams building. About 18 months ago, the announcement was made from federal funds for the construction to the tune of about $46 million for the Inghams building. I need to reflect to you, though, that the work that Inghams has been doing here in Southwest has really a life of about 15 years, and researchers across the district have been working diligently in many different places around the LHD to develop and grow our research work and our profile. And Gadigal is a very good example of that. This is not something that's happened in the last year. It's been going for a number of years. But what Inghams had been very much focused on is actually getting its building, getting funding for its building. That's now been successful and is currently being constructed and will be completed in about mid next year. That's an exciting development. It brings our researchers together, gives a real focus for research in our LHD, and is a real opportunity to grow our work in research over the next couple of years. And I just want to say that in terms of the next year in our future development, research and teaching in our LHD is absolutely critical. Our capacity to staff Liverpool and to staff Campbelltown Hospital will rely on our ability to attract a whole range of clinical clinical staff, and research and teaching and the quality of that will give us a great capacity to be able to do that. So that's a really exciting development. The chairman also spoke in his speech around the strategic plan. That will be a really important piece of work that we'll do in the beginning of next year. The Minister asked in her first couple of months of appointment for the board and the clinicians and senior executive to provide a strategic response, which we got together and did. And that was about saying what are the key, what's our visions, what are our challenges, and what are the things that we need to build on, and we provided that, and it was a really good baseline. Now, though, we need to move into a much more comprehensive strategic planning process, and as the chairman inferred, there will be extensive consultation. And that's critical because things in South Western, although there has been a lot of planning, have changed over the last about 5 years, and it's really important that we actually now move forward. In conclusion, I just want to take a couple of moments to sincerely thank the staff. When I've moved around the LHD, and the aim of the executive has been to very much get out to facilities, services, and to be a very much publicly out there with our staff. The commitment that you see at all levels across the organisation, from the volunteers and auxiliary who you constantly see either at stalls or supporting the organisation, to the hard work that's done by staff in many areas across the LHD. It really is of great pride that I can say that I'm the Chief Executive, and the quality and the work that's produced from this LHD is because of that commitment that happens every day, 24 hours a day, 7 days a week. And I think on behalf of the executive and the board, I want to really acknowledge that. I also just want to acknowledge the contribution of the community. The community sits on many of the governing committees of the organisation. They have great input and comment on the developments. They've been in planning processes. That requires their time and commitment, and it's people who are genuinely committed to the growth of health in our LHD, and I think we should not ever undervalue that commitment. Thank you.